Hello, everyone. I'm Al Degan, creator and producer of the Leaders, Innovators, and Big Ideas podcast, supported by Rainforest Alberta. This podcast showcases the people who are working to improve Alberta's innovation ecosystem. I hope you enjoy my conversation with medical device startup aficionado, Kelly Mottet. Here we go. Hey, everybody. Welcome to the LIBI podcast. I have an awesome guest today referred to us by another guest, Gordon Shepard. And with me today is Kelly Mottet. Kelly, thank you so much for joining me today.
Thank you for having me. I'm excited to be here.
Now, you have a really interesting company and a really interesting product that I really want to talk about. But before we go there, I want to hear a little bit about your background because maybe the listeners listening to this show may not know who you are. So let's bring them up to speed and maybe talk like the more brief version of your life story.
Yeah, for sure. The brief version of my life story. I've been involved in the startup medical device product development space for about the last decade. And to be honest, I fell into it. Right out of school, I was part of a company here in Edmonton called Effects Life Sciences, who you may know is the manufacturers of Cold FX. Shortly after I joined, they were hostily acquired and my position was let go. And I fell into this great startup called Innovative Trauma Care that was doing a pre-hospital bleeding control device. I was one of the first hires into that company. I was still very green and I caught the startup bug in that environment, getting to wear many different hats as you do in a startup, even if you're a junior employee. And since then, I've been involved in new product development, launching medical devices globally, and now find myself in a C-suite position running a different medical device startup also focused on bleeding control. So that is, in a nutshell, my background.
That is so cool. So you're the chief operating officer of a company called Mach 32. And that's where I saw that you had this tech that stops patients from bleeding to death. So I definitely want to talk about, but now actually I want to rewind a little bit and understand what's the difference between the previous company where you did a bleeding control device and are they close? Are they similar or is it something completely different?
Yeah, that's a great question. And I'd say that they're complementary. When I got involved with Innovative Trauma Care, I know there's no video on this, but it's a clamp-like device for external bleeding. Kind of mimics suturing. It's on the market globally, recommended for use by the US military. Very simple, mechanical type of device that's used. And then you fast forward that to when I met Mark Curiel, who's a co-founder at Mach 32. He had this idea for this auto-injector for bleeding control. So think like EpiPen, but for traumatic bleeding, where we're taking a generic drug that's clinically proven to reduce the risk of death due to bleeding by about a third and putting it into an EpiPen or an auto-injector-like device to make delivery of this life-saving medication quick and easy. What's really important to know is that despite the fact that this medication is clinically proven, less than 5% of eligible patients actually have received this drug in time, which means we have a delivery problem for this life-saving bleeding control medication. And so that's the problem that we're solving is we're making it simple and easy to use, just like an EpiPen. So the first product was very mechanical, meant for external bleeding. The second product that I'm working on now is this drug device combination product that can be used to treat internal bleeding, external bleeding, and it works in complement with any of your other bleeding control measures. So whether that's direct pressure or an IT clamp, like what I worked on previously, or what else do? We elevate, we put direct pressure, we put tourniquets on. It all works complementary to that.
That is so fascinating. So I'm imagining, as a completely uneducated in medical devices and stuff like that, I'm assuming the medication itself does some kind of blood clotting or something, like in the area around the wound or something.
Yeah, that's a great question. So it's actually a systemic drug, and it works throughout your body. And what it does is it prevents clot breakdown. So it doesn't promote clots. It just prevents their breakdown. And the net effect is that it allows you to make more stable and better clots. And what this does is downstream, and this has been shown in multiple different clinical studies, is that reduces your risk of death by about a third, but it also reduces the need for blood transfusions and reduces your hospital stay as well, because you just don't get as sick. And I'll say, I'm not a clinician. I don't have any medical training. I have some first aid training, and that's about it. But I'm not a clinician. This is stuff that I have learned. I've learned the science as I've been involved in these different startups.
Excellent. I won't dive deeply into the technology itself and the medical application, but maybe perhaps we can talk a little bit about the startup side of it, which is, we talk a lot about startups on this podcast. And one of the things that popped out into my mind when you first started talking was, it must be so difficult to get a medical product through the healthcare system. Can you talk a little bit about that journey now that you've apparently done it more than once?
Yeah. Oh, that's such like a open-ended question of what is it like to take a product through? It really depends on the product that you're working with. When you're working with a simple medical device, like we did at Innovative Trauma Care, simple, robust, life-saving capabilities. It's mechanical. It doesn't have any drugs. It has minimally moving parts. It's really about setting up your quality system, getting the right certifications for your quality system, and then submitting your dossiers to whether that's Health Canada or the US or in the EU, submitting your documentation. And it's not that bad, I would say. The bigger challenge is raising the capital to fund the studies that you need to fund. I find that investors are leery of MedTech companies, maybe because the timelines are a little bit longer. There are many days when I'm at a pitch event and I see all these little software companies or apps pitching, and I'm like, oh, I wish I was a software. Like, we would be on the market, we would be generating revenue, but really it takes time to bring a medical device to market. So I'd say that's one of the big challenges. And then the second big challenge, which isn't necessarily related to regulatory, is just market access, is making sure that you have users who will purchase your product at the end of this. And if you don't appropriately plan for that at the beginning, you can be in a world of hurt while you're trying to establish those end users and establish those sales channels. It's not just a magic door that opens once you get FDA or Health Canada approval. You really got to build that along the way.
Great. That makes a lot of sense. And I imagine some of the key difficulties you outlined already is investors being a little bit shy. Can't even imagine how one would start with that. Like, you're sitting around the coffee table and I've got this great idea. And then unless you have a big chunk of money to start with, like, how would you, maybe you can't answer this, I don't know, but how would you even start if you weren't a multimillionaire already, to start dumping your own money into it? What would be the path?
That is such a great question. And I could probably talk for a while about equality in being a startup founder and the access to capital. So I was very fortunate with Mach 32, where, I joined the team when they already had some friends and family. And the male co-founders that I have at Mach 32 were able to raise $500,000 from friends and family to get this idea off the ground. And I've never seen capital being raised so easily in the time that it was. Raising capital a few years ago was very easy. It was very easy. And we're building a life-saving product that's clinically proven. We're really just changing the delivery mechanism. So it's a really nice story, but it's very different for many other people. And we have to recognize that the privilege that we have in being able to get $500,000 from friends and family is a massive privilege to be able to do. And I see many other young founders, student founders, female founders who don't have that same type of access to capital from friends and family. And this is where I think things like angel investors can be really important. Things like Alberta Innovates can be really important. Even IREP can be really important. And all of those things were important on our journey as well at Mach 32 in raising capital and being able to access some of those non-dilutive fundings to really test out an idea.
That makes a lot of sense. And it does mirror a little bit the journey of like a regular tech startup, but then there's probably an order of magnitude in the numbers that's different, right? Building a software product, $10,000 may not get them all the way, but it'll get them fairly far. And if they were to get 50,000, they could be really close to a good solid MVP. Whereas a medical device, just creating the physical thing requires probably hundreds of thousands of dollars, if I'm not mistaken. And then trying to get through all of the testing and regulation stuff like that must be moving it up into the millions of dollars. Is that fairly accurate?
Yeah, I would say depending on what your device is, if you have a more simple device like what Innovative Trauma Care had in the IT clamp or mechanical, you can prototype and design that relatively cheaply using things like additive manufacturing. We say additive manufacturing like it's somehow fancy, but really just means 3D printing components and stuff like that. So you can do that at a lower scale to really test out your proof of concept. You can get it in the hands of users. You need some engineers, you need some access to that type of equipment. If you're working on anything that has like a drug component or anything like that, your costs just skyrocket. So, for Mach 32 and building an auto-injector, sure, we were able to prototype it in the couple $100,000 range and really get a robust design. Now we need $5 million to take it into manufacturing, and we're going to need another 15 to 20 million to get it to be ready for clinical studies. And then we're at clinical studies, and then we'll need more. So it really can depend on the specifics of your device and how much money you're going to need. But you're right. Nobody's doing it for $50,000. That's just not happening in the medical device world. And the testing can be really challenging because you need to have your testing done on commercial ready devices or commercial equivalent devices, which means you need to invest significantly in your manufacturing process. You're probably getting injection molds. You're building out that process. And then your final testing all has to be on that product. And then you can submit for regulatory approval. So you have this delay between spending all this capital, doing this testing, and then waiting for approval. So that can be quite challenging as well.
Yeah, it makes sense that they wouldn't be interested in testing a 3D printed prototype or something. It's just to show that it could potentially work. And then they want to see the thing that you're going to be putting on the market, and they want to test that. And that makes perfect sense.
Exactly. But 3D printed prototypes are perfect for taking to potential end users and getting their feedback. Because the earlier you get feedback from your end users, the cheaper it is to make any of the design changes that they say. And we've made significant pivots at Mach 32 without getting into too much of the science. Our initial concept was actually very different than what we're bringing forward today. Our initial concept was, believe this or not, was a sternal, so into the chest bone, interosseous device that delivered this medication. So very robust, very quick delivery, that type of thing. And the simple, we'll call it simpler, EpiPen idea was our secondary idea. And then when we took those to users, we put prototypes in front of them of the interosseous or into the bone device. And every single user that we talked to was like, yeah, that's nice, but tell me about this other idea that you just mentioned off the side. And so we made a significant pivot to put the into the bone device on the shelf and to go full in on the intramuscular, the EpiPen-like device. And that is the right product. And without those 3D printed prototypes, we never would have got that critical end user feedback.
That makes so much sense. And you know what? It mirrors as well people who are building the lower end tech products and software products and stuff like that is you still have to get in front of your user. And even if you're just building a software application, if the users don't get to give you feedback, you're building the wrong thing like 90% of the time. So that's really, I love that parallel. It's really fascinating to hear that there's so much similarity. It just happens to be on a different scale. Are products that the Mach 32 company that you're with right now, are these products now commercially available? Can you go buy them, or are they just getting there? Are you going through some kind of regulatory stuff?
Yeah, so we are actually pre-regulatory at this stage. So what we have done to date is we've built functional working prototypes. What that means is we've 3D printed some prototypes and we've tested them in live tissue, which means we've done some animal work to show that the drug is rapidly absorbed and it's going to be effective in the body. So we've done that. And we're actually really pleased to announce in September of 2024 that we received a contract from BARDA, which is part of Health and Human Services in the US. BARDA has a $2 billion budget every year to prepare for natural and man-made disasters that occur. So they do everything from flu vaccine development to medical countermeasures for what if there's a nuclear meltdown or a nuclear attack. I'm really impressed with them because they do doomsday planning all day, every day.
Wow.
Yeah. And they've given Mach 32 a contract, not non-dilutive funding, a contract, an R&D contract to develop our technology through to preclinical tests, additional preclinical testing. We are working on the drug component of our device primarily in this funding. And it's a real vote of validation from a group like BARDA, who it funds a lot of products like this. They have been responsible for getting over 90 products approved by the FDA and into the market to address these emergency type situations. So we're on the development path. Even though we are working with a generic drug, we are creating a proprietary formulation of it. And we hope to be on the market in 2027 with our first product. So on the path.
That's cool. And it sounds like it's really nicely lined up. So would that be, and pardon my naivety, but would that be equivalent to, say, Pixar partnering with Disney to approach one of the major film companies to do a movie? Is that kind of a similar line there?
Yeah, so I'm not really big on the film industry, but it sounds like it might be on the same line.
Yeah. So your company is under the wing of some big company that's done it before and knows exactly how to move it to the bigger company, which might be the buyer of the product in the end.
Yeah. So it's really interesting because the BARDA organization is part of the U.S. government, and they fund these projects to help the U.S., but really the globe, prepare for these natural disasters. But they're also a purchaser at the end of the day as well. So they help us. I'm going to use the term, they're like an angel investor, if you will. They give free capital. Angels don't give free capital. I know that, but they give non-dilutive funding in the term of a contract and allow you to continue exactly on your development journey for a commercial product. And they're fully supportive of you commercializing it. They want you to be commercially successful as a business. So they're very much more like guides. And the other really amazing thing about them is they provide subject matter experts that support us. So like when we meet with them on a regular basis, they bring experts with 20 plus years of experience at the FDA reviewing similar products to help guide us on this journey that we're going through and help really accelerate it. So let's tell them somewhere in between like an angel group, accelerator, purchaser type of organization.
Oh, that's absolutely brilliant. That's like almost the ideal situation for a startup to be in, is to have that kind of helper, mentor, buyer at the end of the day. And let's be honest, non-dilutive funding is the best funding to get.
Yes, it is.
That's brilliant. Is there anything else that you'd like to talk about with regards to this topic, or anything that I don't have the experience or knowledge to ask you?
No, I think if we're talking about the startup space and my journey there, I think I would just like to really emphasize on the ecosystem being really important and how much support we have gotten from friends who believe in what we're doing, whether that's financial or not, or it's just an end user who's willing to endlessly give their time to give us feedback and tell us what works and not. We've been the benefit of Alberta Innovates funding, which is provincially non-dilutive, IRAP, which is federally non-dilutive grants, but also places like CAMS at NATE, where they have advanced medical simulation, where we can go in and we can work with paramedics and see how they would use our device and get more feedback to, investors through Startup TNT. And I think that ecosystem of support for startups is really important. I think that's the only other point that I would make about that journey.
Oh, I like that. Great way to wrap that up. It's that whole concept that keeps resurfacing is it takes a village. You can't do everything on your own. You can't hide and keep your cards close to your chest and sneak by everything. You have to be out there sharing and being open and getting help and asking for help and then giving back and giving help and supporting. Like I could imagine an organization like yours and having gone through what you're going through, you're probably the very first ones to be able to help another small company out that's trying to accomplish something similar. Hey?
Yeah, we try and give back where we can. We have lots of conversations. I have regular coffees with strangers or new friends, maybe what they're going through, where they might be able to access resources and such. And I've been privileged to be a part of some really great accelerators in this country and in the United States, where the community that you build there is really important. And they say that about, I don't have an MBA, but they say that about going and getting your MBA. It's the connections that you make that can serve you really well. There are connections that I've made just because I've sat down at an accelerator at a table, and I know that those will be long-term connections and will help each other over the next 10, 15, 20 years type of thing.
Awesome. I really enjoyed this conversation. I think it's fascinating to see the parallels and with the startups in the tech ecosystem and the MedTech ecosystem just must be absolutely fascinating and very you can just see lives being saved and people having a better outlook on life and better for the prosthetics makers and all those sorts of companies. They make people's lives easier and more bearable and enjoyable and that kind of thing. It just must be really fascinating to be in that industry, that ecosystem. And I really enjoyed talking to you today. Thank you for joining me.
Thank you for having me.
Awesome. All right, everybody else, we're going to have another episode next week on the Leaders, Innovators, and Big Ideas podcast. Thank you. Cheers. If you haven't already, visit rainforestab.ca and sign the Rainforest Social Contract. Become part of the inclusive, silo-busting, sector-agnostic, all-industry, open-sourced, ego-shrinking, ecosystem-building, entrepreneur-focused, wide-open social barrier-smashing community known as Rainforest Alberta.
This episode is brought to you by New Idea Machine, a unique blend of a tech incubator and a software development powerhouse. We're not just building software, we're crafting the next generation of homegrown tech wizards. Got a project in mind? Or looking to hire fresh talent? Reach out and let's make tech magic happen. Visit newideamachine.com for more info.
Music for the show was created by Tony Del Degan. Please be sure to share this episode with everyone you know. Also, don't forget to come by and say hi at the next Rainforest event. Let us know what you think of this podcast. If you're interested in being either a host, sponsor, or a guest of the show, send me an email at rainforestpodcast@gmail.com. Thanks for listening.